In this video, I'll demonstrate hand washing using soap and water. This skill is actually going to be a Chekhov skill, which is pass-fail, but we'll do that when we get to campus. The actual skills sheet is located under the course content, but I will review that tomorrow. I just want to make sure that you guys know how to do this, okay? There's two different ways that you can do hand hygiene. You can either use the soap and water, or you can use the hand gel, okay? I sort of have a rule: if I do 3 times or 2 times of the hand gel, your hand become a little sticky. It's a good idea to wash, okay? Because at that stage, it means your hands aren't clean anymore. A few different when we need to do hand hygiene is anytime we go to the bathroom, we're eating and drinking, any patient contact, if we're wearing gloves and things, it's a good idea to hand wash, okay? So first and foremost, the first thing we do is you always want to make sure that you keep yourself clean and dry. Anything that spills over and get onto your uniform is contaminated. So you want to make sure you have a good distance from the actual sink that you're using. If you're using or wearing any wedding rings or wedding bands, as long as it's plain, you should be fine. If it has any stones and stuff in it, it's a good idea to take it off, because contaminants actually get trapped in between the little stone areas and stuff, and then your hands are still contaminated. So first thing you do is you're going to go ahead and you're going to open your tap, and you're going to make sure that the warmth of the water or the water itself is an appropriate temperature, because you don't want to burn yourself as well, okay? First thing you're going to do is, best thing is you want to make sure that your hands are always facing down. The water needs to run down your hands to make sure that any contaminants that's on your hands is actually washing or going down the sink, okay? So first thing I'll do is I'm going to wet my hands, and I do part of my wrist as well. They suggest about 1 to 2 inches above the wrist. I'm going to go ahead and I'll apply some soap, and then I'm going to rub them into my hands first, okay? So I'm going to do my palms first, and then I'll do the backs of my hands. I'm also going to do the palms of my hands with my fingernails as well, just to clean the tops or the fronts of them. And then I'm going to go ahead and do the back of my hands as well, including my fingers. I'm going to do between my fingers, and I'm going to do every individual finger as well. So this process is you're supposed to take about 20 seconds. That's when they say it's most effective. And then the last thing I'm going to do is I'm going to go up to my wrist. Once I know that I've done all of those components, I'm also going to go under my fingernails as well. I do every single one. You can use the fingernails on the other side, but sometimes they'll have little sticks that you can use in the hospitals, but that's not always available. And then I'm going to go ahead and rinse. So water always running down, nothing towards the elbows, because it means your hands are further contaminated. Okay, and then I hold it down and let the water just run down. Once I'm done, I'm going to go ahead and pick up a paper towel, and I'll wipe down my hands, and then throw it away, and then I'll use the second one to make sure my hands are completely dry. And then I use a clean towel to close my tap. And that's how we do hand hygiene.